Our correspondent Dave Keating is live in Brussels. Dave, Ursula von der Leyen just had something to say about testing. What did she say?
Well, yes, she said that the coordination efforts are going to move forward very quickly, starting in mid-November. Basically, they're trying to all have the same joint policy about testing, both in the short term and in the long term. So in the short term, what the EU wants to see is the same testing requirements for travel, so that every country would require the same testing regime when people get back, and for how long they should quarantine for if they've been to a red zone. And she also wants mutual recognition of testing across EU member states. Now, this specifically concerns these new rapid tests that are becoming available. Some countries are enthusiastic about them, others are not, because while they're much faster than the test that we've had so far with the nasal swab, they are not as accurate as the nasal swab. The advantage, of course, is that somebody could get a quick test and go straight on a plane. The disadvantage is the result might not be accurate. So she said now that during that call tonight, there was a relative agreement, it sounded like, about those rapid tests. So we'll have to see that in the coming weeks. She also said there was consensus that countries will not close EU internal borders during these second lockdowns. That's been a big question because that happened during the first lockdowns. But she said the lesson was learned then that while that majorly inhibited goods traveling across the EU, it didn't do anything to stop the spread of the virus. So she says it's not going to happen this time.
Is the EU also developing a strategy in terms of vaccines and how they might be distributed?
Yeah, that's the long-term strategy. Von der Leyen said she expects that vaccines could become available next April at the earliest, and she wants the distribution to start happening immediately. They want national EU governments to start submit national plans for distributing vaccines by mid-November. She says that the EU will coordinate the delivery of those vaccines. Every member state will get equal access to the vaccines, and they'll get a number proportionate to their population. It's not going to be a question that, France gets it first and Malta gets it last. Everyone will get it at the same time and with the same conditions. She promised that tonight. And that's going to be the big focus when they look at the long term, is how to rapidly, the minute that a vaccine is tested safe, and she stressed the EU will absolutely make sure that a vaccine is safe before they pull the trigger on distribution. But she said by that point, national governments and the EU have to together have a plan to immediately start distributing that vaccine.
Okay, Dave Keating reporting live for us from Brussels. Thank you so much.